to limit background noise. If you could please do your best to mute when not talking. If also, as staff, will be monitoring the room, so if we do see that there's some background noise and someone's unmuted, we will mute you just so that we can ensure everybody is being heard. We would also ask for folks to use the chat and the raised hand function so that the chair and staff can recognize folks. Also, for members of the public, you are able to utilize the chat to share ideas and comments, and staff and commissioners will try to address all of those comments either in the meeting as possible, and those that we can't get to during the meeting, we'll be sure to follow up and address either in minutes or follow up with you individually. Also, for our commissioners, members of the public are present. This is an open meeting, and so we just wanted to just be mindful that we do have members of the public here with us today. If there are any questions for these considerations, please let me know, and then if not, I will turn it over to our chair, Mr. Jernigan.
Thank you, Christina. Good morning, our commission members, all of the esteemed legislators and individuals, the professionals, the leaders who are making up this body of a very important group to help Maryland become a trauma-informed state. I appreciate the opportunity to support you all in the capacity of chair. This being my first meeting, I'm extremely humbled and honored to be in this space with you all, knowing the swath of you from working alongside of you in conjunction with you on various efforts in the states, but then also from reviewing the efforts of the Trauma-Informed Care Commission, being able to watch and witness the things that you have been doing in this space. So I appreciate each of you for all of your efforts and look forward to serving in this capacity with you all. What we're going to do now, we're going to review the agenda. Hopefully everyone had the opportunity to look over the agenda at this point and review some of the documentations that have been shared and previous correspondence from Ms. Christine Fogel. So as far as the agenda, you see what things we're going to do today, we're going to vote on the implementation and our technical assistance work group presentation with the Maryland Way as we look to, as you guys develop trauma-informed, resilience-oriented, equitable care and culture standards and strategies. So just be great to actually learn more and see you guys as it relates to the voting process and hear your responses to that portion. Then we're going to actually do a vote next for the ACEs Aware legislative report, which is due on October the 1st, which is right around the corner. So definitely looking forward to the voting process for that. Then we're going to go to work group report outs and updates from the various committees and work groups, should I say, that's been doing some great work since the inception of the council. And then we're going to move forward afterwards. Next, I will actually provide some very important staff updates. As you remember from the last meeting, Jessica, we announced to you all that Jessica has transitioned from our agency, and in that role now is Ms. Jennifer Crable, who's been at the office for a few years now, who's been bringing a lot of value to the governor's office, crime prevention, youth and victim services. But then also more importantly, she's been involved with a whole lot of efforts that's so related to the efforts of the council. So I definitely wanted to introduce Jennifer as our new chief and just definitely thank her for her service. We can now go to Christine Fogel for the roll call and introductions.
I believe I have everybody down. If there's any new representatives or new designees that we don't currently have or who have not previously been designees, please let me know. Otherwise, pretty sure I have everybody.
Great, thank you, Christine. So the next item on the agenda is approving August meeting minutes. So everyone had the opportunity to review August meeting minutes, and just wanted to provide the opportunity for us to, discuss them or even get approval for those meetings from the meeting minutes from last month. So with that, I will ask, is there a motion to move forward with the approval of August meeting minutes?
Motion to approve.
Thank you, Frank. Thank you, Frank, and thank you, Delisa. Any nays? Okay. Thank you. We can move forward. Next on the agenda, we're going to talk about the vote that we discussed earlier with the Maryland Way Trauma Informed Resilience Oriented Equitable Care and Culture. Is Elizabeth on today's call? Elizabeth Gurov?
Yeah, I'm here.
Okay, thank you, Elizabeth. I'll pass it over to you.
So everyone should have gotten the updated document with the definitions for anti-bias. So we've kept the anti-racism, anti-bias, and social justice. So at this point, I think, Christine, we're ready for a vote, unless there are any further comments on the full document.
You know, we were also able to make the changes around the ACEs, including the PACEs in the back and adding the language around, we reserve the right to add as the science advances. So those changes were made as well. So basically everything that the group discussed in the previous meeting has been added. And those changes have been made, and the document that was sent to you is the result of those changes.
So I move that we vote to adopt the Maryland Way document as our principles and implementation guidelines.
I second that motion.
Thank you both for those motions. Is there any nays or any discussion from any commission members? Okay, hearing none, I think it's time for us to move forward. Thank you for the votes and for your work to establish this document. The next item.
We didn't vote.
Oh.
We got motions, but we didn't vote.
My apologies. Thank you, Inga. So how will we move forward with the voting process? Is that everyone, I guess if there's individuals who have already voted already, if you wanted to note it, that if you already have what I'm saying is if you have a vote, should I say, I guess we can uplift that in the space at this moment. My apologies. Inga?
Did you want us to vote now? A or nay?
Yes.
Okay. Okay.
So we did the nays and there were no nays. So I think the assumption was that everyone else was a yay. Were there those who wanted to abstain?
I think you have to collect the yays anyway. Sorry, Christina. I just think you have to do that. Sorry.
Should we note our vote in the chat?
Yes, that sounds like a great idea. If you can make a note of that in the chat.
And again, the vote are for commission members to vote.
Thank you for those who have voted. I've seen a swath of yays in the chat. There was also Christina. I'm trying to pull back to get Christina Bethel. I was trying to get back to her her comment that she inserted in the chat. Christina, if you wanted to take yourself off of mute, you could uplift that in the space at this moment.
Yeah, no, I just think you're doing such a great job, and I also assumed that if you said there weren't any people who didn't want it, that meant everyone did. So I just don't know if that's like a statute thing that someone was saying you have to do it that way, but that seemed reasonable to me. But if you're going to have a vote, I would suggest having a private poll if it's possible on this platform. So because it's always nice to vote. Well, anyway, I think you can just do a poll and have it be a private poll if you want to do it in the future. I don't think you can put it up now. That was really all my point was. But I thought it was reasonable how you were doing it. And I wasn't aware that we had to be actively voting versus just saying no. So that makes sense too.
Yes. All right. Thank you.
Mhm.
Thank you for that suggestion. And we did get a little outside of our normal protocol there, but I guess with all of the votes that came through, is it safe to move to the next agenda item?
But before we move, can I just thank everyone for their participation? I think it was a really great collaborative effort in terms of getting us across the finish line and move the principles and the implementation work. So thank you, everyone.
Thank you, Elizabeth, and I definitely reply with those same sentiments. I'm going to pass it over now to Christine Fogel, as she's going to seek to get us a vote on the ACES Aware legislative report.
Fred, your hand was up. Did you have something to say about this, or was it still about the vote? Oh, okay.
Here, wrong button. Sorry.
Okay. I did want to say to the last issue, I just want to thank the operational and implementation work group, because they did an amazing job, not only at creating this document, but pulling it together with the work of other work groups, as well as presenting it to the commission last month, incorporating all the comments from the commission, and then bringing it back for a vote. It is an excellent example of how the work groups in the commission should be working together. And I'm just incredibly grateful for the way that all went. And I just want to give props to you guys, because you guys did an amazing job. And so thank you for that. And moving on. The ACES Aware work group has been working on this. I am presenting it because Carrie Freshour, the chair, is currently out of the country. And so she is unable to do so. It has been reviewed by the work group. It has been reviewed by Deborah Badwe, who is and I'm not sure if I'm saying your name right, please forgive me if I did not, who is the Maryland chapter of the American Academy of Pediatrics, representative on both the commission and the work group. Dr. Christina Bethel, who we are pleased is part of both our commission and our work group, because she was actually one of the original people who worked on the California ACES Aware program. So she's very familiar with it and able to provide a wealth of information about the program and insight for us as we look at the program for Maryland, as well as the 3 partnering agencies who did a great job at reviewing the document and putting their input in. So Maryland Department of Health, again, always a wonderful partner, both the Medicaid Department and the Behavioral Health, as well as the Maryland Healthcare Commission, which is a new partner with the commission and with the work group. And they are named in the legislation as a partner on this particular part of the legislation. And so they've been involved in the writing of this grant. So this particular document reflects the work of the progress that the work group has gotten to thus far. We have not, as a group, been able to get to a point where we're able to make a whole lot of recommendations thus far, either to the commission or the governor and the legislation. But what the document is basically doing is a retelling of what the work group has accomplished thus far in terms of the information that we've gone over and what we've learned thus far. And much of the recommendations have to do with the fact that in order to do anything similar to what California has done, regardless of what it is that we decide as a group needs to be done, it will require a great deal of funding. So that is, in essence, for those of you who were able to read the report, the gist of what it says. But based on that, were there any questions or comments that anyone had about what was in the report? Anything that anybody wanted some clarification on before we call for a vote?
Christine, I just wanted to say, oops, sorry, I didn't raise my hand. Malcolm, you go.
No problem. Thanks, Dr. Bethel. I just wanted to say that this is a very well done document. I think it really does capture a lot of the sentiments and where we are, and it's a really good start off point for us for where we can go with this. And I'm really want to thank both Carrie and Christine. She put in a tremendous amount of work into this. And I really do think it's a very, very well done document, and I very much support it. Thank you.
Yeah, my comment was also one of accolades. I really appreciated the table that you did, which I do a lot of that kind of crosswalk. It's not easy to do. And then that made it really easy to comment. And you'll notice I did comment pretty quickly because you made it so easy. And so however we can do that kind of thing again across the different work groups, I think it really is effective. And I really, having been very, very involved in the California project, am excited about that analysis and the opportunity to build on that progress and not make some of the same mistakes too. So I just mostly wanted to just say thank you, and I think it's in a good place. I'm excited for the next steps.
Thank you. Okay, so are we ready to call for a vote? Does anyone want to make a motion? Actually, I'm going to leave this to William because this is actually William's part. If nobody has any questions, I'm going to pass the ball back to William.
Thank you. And I was definitely coming on, just definitely want to make sure that all the comments were delivered at that time. So we're going to move forward. So is there a motion for approval?
I motion.
Thank you, Ulysses. Was there a second? I heard Senator Augustine.
Second.
Thank you, Thank you, Senator. Christina raised your hand, and Wendy Lane raised their hands.
It's just to favor. I didn't know if we were raising hands before putting it in.
Could you repeat that, Wendy? I think there's a little choppiness going on.
Are we raising hands to vote in favor, or are we typing it in?
No, I was raising hand a second.
Yes.
Okay,
but I was
so
doing it well.
yes, so we similar to the last time. So we have the motion. We have the first and the second motion, and I'm at this point. Do we have any nays? Did anybody oppose? Okay, hearing none, I think we could definitely move forward. Moving forward, what we're going to do, just as Christina suggested, we in advance we could supply polling, so that way we can have private polls and moving forward. But I think it's at this time, I think it's safe. Unless anyone had any other discussions about this, we could probably move forward. How does that sound? Okay, Matilda?
Yes, I do like and appreciate giving folks the opportunity to submit a private vote, but I do want to highlight or center the trauma-informed way in which presenting the vote to the public could be beneficial, and allowing the public to see where each of the individual commissioners stand, and considering the fact that some of these oppositions could be instrumental to the conversation around creating a trauma-informed care network in the state. I would like, if it were possible, to have some kind of public demonstration of the vote along with that private feature.
Great point, and thank you for that suggestion, Matilda. Senator Augustine?
Thank you. I was in a similar place, but also just in the place of as this commission, and it's basically it's a public entity, and we do when we are making votes and things like that, I think just by virtue of the nature of what we're doing, it likely does need to be a public vote. I do understand sort of like where it's coming from, but in keeping with what the previous speaker just said, I think that I also say it's okay to vote no. It's okay that we would see perhaps that there are some things, and we can understand sort of where things are going, and folks that have opportunity to speak about where they come from. But as a public entity, I mean, our votes and the things that we do really does belong to the public, and that's just a part of what we have as a responsibility in this group and anything like it. Thank you.
Thank you, Senator. I definitely agree. Elizabeth, you had your hand raised.
Yeah, I would just also agree. I think that it needs to be public, and given the very robust conversation we had just on the values, I think, we've done a good job of being transparent and open. And I think as we continue with those values, open votes, I haven't seen anyone shy away from sharing their opinion on the commission yet. So I think we're in good space to, keep things really public and open. And I think, as Matilda said, the discussions are helpful for the public to really understand where the different opinions are coming from, and that only advances the work, in my opinion.
I wholeheartedly agree. Thank you. Frederick? Frederick, you have a comment? I see you raised your hand. Also want to okay, go ahead.
Thank you. In support of what everybody has said, because I don't think you cannot vote, but not show your vote, rather. We've always said this is a working document. I hope it doesn't stop here. I hope we hear from other people, and I hope this grows. So I think this is done in that spirit also.
Yes. Thank you. Christina?
Oh, I also just wanted to share, to Fred's point, that this is just the required legislative report. So this is just an update status of where we are in the work. So to Fred's point, the work continues. And while this document may not change just for this fiscal year, the work will continue to change. And this work group and this work will continue to be reported to the legislature, and the progress that is being made towards those goals. So again, it's a living process. While this actual document is not a living document. So we're not going to be going back and amending this document, but the process and the information that is shared will evolve over the course of this commission's work and in the various reports to the legislature and the General Assembly. So I just wanted to make that small distinction.
And there'll be another report next October.
Thank you. And also wanted to uplift Frank's comment, was synonymous with those that was shared before as it relates to transparency and actually ensuring that those votes will actually be placed within the meeting minutes for review. So thank you for that comment as well, Frank. So I guess we're all in favor that we're moving forward with an approval. Awesome. So the next things that we will discuss, I will pass it over to Christy I guess at this point we're going to do the work group report out and updates. So the first.
William, do we need to actually have everyone vote yes for the ACEs Aware document in the chat? If we want.
Yes.
Yes. Okay. So if everyone can vote yes, if you agree with it, that would be great.
Thank you. So we can make record of all the votes. Thank you all who have voted. So I guess it's safe to move now with work group report out and updates. A couple more approvals coming in. The first group who's up for report out is actually the core values and definitions group with Sherry Price. Sherry, are you available?
I don't see her in the meeting, but what I can tell you is that they have their first meeting scheduled for later this month. And so they will have a report out next month.
Awesome. Thank you. The next group for report out is metrics and assessment. We have Kay Connors and Margot Candelaria.
Hi, Kay's here, and Joanna Prout is going to help as well. Margot's at a different meeting today. So we met this morning and we talked about a couple asks for the group, and then I'll let Johanna talk about the data and action efforts. But one of the things that we've noticed is that our group is very heavily focused on behavioral health, because that's kind of who shows up at the table, and it makes a lot of sense because there's a lot of work done in that field. So we would love to think about a good strategy to be able to tap into the commissioners as resources, maybe not to always join our group, but maybe to have some targeted time where we get to hear about their needs and, where things like that we find in the behavioral health world might not translate and what the gaps are. And the other thing that Jay mentioned today is that we have to walk the walk and do the best we can to have consumer, youth and family and community voice in our group too. And so if there's a way we could work with one of the other subgroups to be able to get that feedback, and we'll also work on some strategies to see if we can recruit someone. And I'll let Johanna take the next part.
Sure. This is Joanna at University of Maryland School of Medicine. The other items I had noted for report out were that we are looking for a new co-chair or chairs. We are developing a logic model, and we'll report out on that more in upcoming meetings. We are compiling and organizing resources to share, and we are looking to align all our work with the Tyro vision. I think that's it. Kay, anything else?
I think you got it. And just to, we really commend the group putting the Maryland Way together, and it really mapped onto many of the things that we could find. So it was very exciting. So thanks.
Thank you, Kay and team, everyone who provided some commentary during this portion. Is there any comments from any other council members, commission members, before we go to the next work group? Okay, hearing none. The next group up is the training work group with Amy Merrick and Janice Goldwater.
Hi there, Janice Goldwater here. We had a absolutely wonderful meeting, but I just want to begin by thanking all of the commissioners and the whole group for the incredible work to come up with the Maryland Way. It's been such an incredibly inspiring experience and process, and I think it's a beautiful document, so thank you. A lot of the work of the training group has been contingent upon passing this, so we're really thrilled. And we were thrilled that Lisa Druck came to our meeting and kind of walked it through with us. So thank you, Lisa or Elizabeth, for coming and taking the time to work together. When our committees work together, we can really make a whole lot more progress. So I'm really excited about that. The most pressing thing on our plate is coming up with the first training that's required within the mandate for the commission to train all the commissioners and the 2 agency representatives within that first year. So now that we have the Maryland Way and the ACE interface work approved, we're able to now move forward to design, based on the principles of the Maryland Way, a training that we'll be able to deliver. So our committee, our work group will now be working on putting something together, and we're looking at taking the ACE interface training and marrying it with or partnering it with the trauma-informed care principles, and really taking all of the components of recognizing who it is we're training, how people take in information, and really providing something that's going to be relevant and relationally based, so we can build on connections and all of the principles of the trauma-informed of the Maryland Way. So that is what our group is working on. And yes, Department of Aging, I hope Department of Aging is included, because we're really talking about
all human beings in the state of Maryland. And so we will be meeting with our group and also other people to make sure we've got something tight together and relational that we can roll out this fall. So that's it. Our group we've changed the date of our meeting for October. Yeah, for October, since Amy and I are both going to be out on that first Tuesday. So it's going to be the third Tuesday. So we have sent something out to all of our committee members. But if there's anybody else, I believe when we sent out our minutes from the meeting, we have that in there. So that's it.
Great. Thank you, Janice. In the chat, there was a couple of comments that came just before Janice started speaking. I'm not sure if they was for the previous report out. It was one by Christina Bethel. The question was, are there any measures on the table for recommendation? Christina, I wanted to give you the opportunity to get that question answered.
Yeah, that would be great. I might have gotten confused, Kay, about what your group was doing. But when you get to a model and measures, I want to make sure I get back involved. I'm just juggling. I'm kind of mad over here, but I didn't know if I missed something. And I was like, I hope I didn't miss something about a matrix with measure starting points or anything that you were thinking about so that I could contribute.
Well, maybe your ears were ringing this morning because I was talking about you right before we got onto this call, saying, we have a national expert right here. So we definitely are, hoping to reach out to you, particularly around, the primary care opportunities.
Yeah.
But we understood our task to be first to look at the organizational or system level.
Yeah.
And that it's pretty hard to find, really well-developed trauma-informed systems. Trauma Transformed probably has the most comprehensive look at that. We definitely have found trauma-informed organizational assessments in a couple areas. And then we also wanted to have metrics and assessments that were more drilled down for certain sectors.
Well, when you get there, let me know. We had a big measurement group on trauma-informed organizations. There is a gap. This group could fill it. It could be a recommendation. There aren't outcomes-based measures for organizational trauma-informed. It's all process measures, and we don't really necessarily see them linked to outcomes for people. So anyway, that is not for this call. I just wanted to let you know, I want to be stealth and contributing whatever I have in that area, and also keep pointing out that we have statewide data for all children, youth, and families in the state through the National Survey of Children's Health, which I make available on a point-and-click basis to find out about ACEs and family resilience and flourishing, systems quality, and all that. And it's population-based. So I just want to make sure we make use of it. And that I can help prioritize some of our work to serve this group when you get there.
Yep.
Okay.
Thanks so much.
Okay, good.
Thank you both, and for the collaboration that's going to happen in the future. Frank Cross also added a question in the chat. He says, is there an alternative term for consumer? Uplifting, perhaps recovery partners.
Yeah, and I would just say I don't think that has to be discussed now or today. It was just a suggestion. I think what's really become clear is as the group coalesces around values, consumer just didn't seem to fit as a term that we would use. So something for us to consider down the road.
Thanks for that consideration, Frank. Any other comments regarding Janice's presentation before we go to the next group for report out? Okay, so up next we have operational implementation and technical assistance. We have Elizabeth Gaurav, Inga James, and Dr. Michael Sinclair.
So I can give our update. Obviously, the biggest part was getting the Maryland Way document approved with our implementation outline as well, or, domains as well as the language and the principles. And our next step is actually messaging to the incoming governor and new secretaries. We're looking at both a short video as well as written documentation to really help guide messaging to the incoming administration. And so we'll be reaching out. I've already started reaching out to each of the other subcommittees in terms of putting that documentation together, as well as what highlights we want to put into the videos. Inga or Michael, you want to add anything?
Yeah, I'll just say that we're always looking for people to join our committee. We've got a big job to do. And so if anybody's interested in putting together protocols for changing the cultures in these state agencies, please join us. Thank you.
Thank you, Inga and Elizabeth. We also have an additional question. The first one comes up from Eileen King. It said, when will the Maryland Way document be available for public viewing? And
William,
Christina?
Oh, yes. So Christy and I both said now that it has been voted and approved, it can go, it can go out to the public, and we'll also have it posted on the commission's webpage with other documents following the meeting.
Awesome. Thank you. Eileen actually just said thank you. And other comments, one came from Christina. It says she suggests integrating trainings into existing trainings rather than only separate trainings. And Matilla Sacker actually included in the chat, she said, I may be interested in joining a group, Inga. She said, could you send me a calendar invite so I can find out when the group meets? My apologies for reading that out loud. That probably was something that you two probably could have.
That's all right, William. That's okay. It's not
just trying to be
surprising.
proactive. I just love the collaboration. I love the collaboration. I just saw that, and my apologies if I read that out loud, even though I know you guys are working synonymously to do the work.
Matilla, could you put your email address in the chat? Great, thank you.
And Janice actually gave a confirming comment as well. I guess what we could do now is move forward with the next work group, the ACE Aware work group with Carrie Fresher and staff support.
Yeah, that again would be me, and we did the report. So thank you very much for approving.
Great. Thank you, Christy. Next, our public awareness group, we have Ulysses Archie.
Thank you for having me on today. Public awareness group, we had a meeting in August, I think it was August 13th, and we had Ellis come from New Jersey to speak about what was going on in New Jersey and how they did their public awareness there. We're also right now working on a listening campaign, an internal listening campaign to our members that are part of the work group, as well as listening to what is going on out in the world nationally, as we had the New Jersey group come. And we're working on having the North Carolina group public awareness for trauma-informed in North Carolina, and some other groups that will be coming. So right now we're kind of refocusing. Our next meeting is on the 27th. And we're looking forward to partnering with the other work groups, as well as there's an upcoming training. You can go on to Padlib with Mother Goose on the Loose, and they are, I guess this is what you mean by trainings that are already going on, maybe. And they use the brain science, and they're also in almost every library in Maryland. So it's a good way of understanding and learning how others are doing their work in the community as well as we're moving forward. So I think that's it. You can visit the Padlet and see what's coming up next.
Thank you, Ulysses. Next on the agenda, we have next steps by Ms. Fogel.
Great. I am gonna, a couple comments about the work groups. We are trying to schedule a meeting for the chairs of the work groups so that the work groups can be more integrated and work together more smoothly. And one survey was sent out to the work group chairs to submit which days they were able to attend. And in doing so, I forgot that one of the chairs was out of the country until the 19th. So a second one was sent out to the chairs, and only 4 of the chairs have responded to the second one. So if you can check your emails and respond to the second form so that I can get that date. Oops, I can get that date set so that I can make sure that we can get those chairs together. My main purpose for that meeting is to make sure that we agree on the report templates so that we can make sure that those go out to the commissioners for this upcoming month for October. Our October meeting is obviously on the 20th of October, which means that if subgroups want, or I mean, if work groups want to get reports included in the information that goes out to the commission, they need to be submitted by October 12th. So anything that I get submitted by the 12th goes out to the commission on the 13th so that I can then turn it around. It's just the next day. So that's how that works. But the other thing is we are looking to add a page to our webpage, to the commission webpage that is for the work groups, which will make joining any work group or attending any work group easy, so that it'll have the work group chairs information there, the work group when they meet there, like the date and time that they meet, and any, like if you have a link, a web page or a Google folder or any kind of place where you hold stuff, that'll be there as well. So that is the hope, that we'll have one place on our web page where anybody on the commission or any community member can go to collect that type of information. So that is our hope, but I need to run it past the chairs of the work groups first. The other thing is that, as always, I am more than willing to attend any of the work group meetings. Some of them I'm not sure when they're attending, and some of them, like I tried to attend one earlier this week and it wasn't happening apparently because I was in the meeting and I was alone. So if you invite me to the meetings, I have no problem attending. I just need to know, and I have no problem answering questions or just listening and providing information or whatever. I just need to know when they're happening so I can have them on my calendar and set aside that time for that meeting. And that is it for the work groups. And again, each of the work group chairs is also able to submit questions to me. I also have on my wall all the questions that you submitted at the retreat for each other, which you will be given an opportunity to answer for each other at the work group chair meeting. So I have all that information, and you'll be able to share that information at this meeting. So that is the plan for that. Any questions about that? Thoughts, suggestions? No. Okay, that's it.
Christy, did you want to? Oh, I'm sorry, William. Christy, did you want to talk about the October meeting and what our plans were for the October meeting with the debrief?
We are going to do a debriefing of the retreat. The Anne Arundel County group will probably assist with that, but it will be primarily the work group, primarily the commission discussing kind of how it went, how we can improve upon it. Do we want to do another one? What would we want to do differently? What did we learn from it? Etc. So we will be doing a debriefing at that meeting. We may also have another one of the work groups have something to submit, but I haven't heard from them as of yet if that will be something that they can do. So one of the other work groups may be submitting something for review of the commission by that point as well. I'm done.
Thank you, Christy. So I will go with closing remarks. Before I go, I want to say thank you all for the discussions and the information shared from the work groups, the voting process. Hopefully I didn't cause too many, ruffles within the voting process. Moving forward, I promise, this is my first go around, but I promise to do better moving forward. Just wanted to thank you all for allowing me in this space. I definitely, even though I serve as the chair, I actually want to say that this is a shared space because it's a swath of leaders and you all who's doing a great deal of work and have been doing it over the years, and just looking forward to see how I can better be a part of the process moving forward for you all. As you all know, I'm an open book, not just how ACEs have impacted, trauma have impacted my professional experiences, but even how have it impacted me as an individual. So I look as myself, I'm 45 years old, but I wish I had the opportunity to tell myself many years ago that I will be a part of a group that will be able to address the things that I faced before the age of 18. So I just wanted to uplift all of you for your efforts, your services, your volunteer, and your passion towards the effort, and looking forward to engaging with you all for the upcoming meeting in October. If there's any need, anything you feel as though you need to reach out for me for, please feel free to reach out. That's my contact information. I'm willing to have any discussions or any kind of follow-up with you all, and just thank you all for all the great work you do. And I definitely want to give you all some extra time in your busy days, and just thank you. And we look forward to meeting with you all in October. Inga actually raised her hand before we end. Inga.
That was a mistake. I was looking for reactions. I wanted to give you a thumbs up, but I couldn't. I hit the wrong button. So sorry about that.
Thank you, Inga. I appreciate it. Thank you all, and keep up the great work, and we'll be in touch. Enjoy the rest of your day.
Thank you. Bye.
All right, bye-bye.
Thank you, everyone. Have a great day.
Yeah, take care, everyone.